Good morning, ladies and gentlemen. My name's John O'Connell and I'm the Chief Executive of the TaxPayers Alliance. Thank you for joining us in Westminster this morning as we will launch the second paper in our series on introducing more automation into the public sector. This particular report, written by TPA researcher Ben Ramanauskas, focuses on automation and technology in healthcare. Ben examines various case studies looking at how automation and technology have improved pathology services, cardiovascular diagnosis, medication for insomnia and depression, social care, and other areas too. And that's the key thing about this report and the broader campaign. How can we improve services? As you all probably know, a lot of our work at the TPA focuses on fighting for lower taxes. But the flip side of the coin is campaigning for better services. The tax burden is at a near 50-year high, so we feel that more can be done with the money that we currently spend. There are exciting new developments in technology that we think could be used to improve public service delivery and allow staff in the public sector to focus on their core tasks, the things that they love doing, like patient care, and not reading the latest missive from the fax machine. Embracing technology is crucial to ensure that can happen, and the NHS is particularly important in this regard because it would mean more lives saved. So it's been encouraging to see the current Secretary of State, Matt Hancock, embrace a technology-led improvement in the NHS so that the system itself can harness the talent and hard work of the many doctors and nurses working within it. The TPA believes that the NHS can be improved, but within its budget, more can be spent on new tech to deliver greater returns in the future, which, again, in human terms, means more lives saved. Politicians from all parties should embrace coming technological changes so that public service delivery, not just in healthcare, can keep up with the standards taxpayers expect. After all, taxpayers pay for public services. I'm delighted that the Secretary of State is able to join us this morning as we launch our report, and I'll hand over to him without any further ado. So please join me in welcoming the Secretary of State for Health and Social Care, the Right Honourable Matt Hancock MP.
Well, thanks very much indeed, and it's a pleasure to be here at the TPA, and I was keen to come to this event to underline the importance of using modern technology to deliver the best services possible. And I come at this from a very simple viewpoint. I love the NHS because it's always been there for me and my family, as it is for you and for yours. It's been there at some of the best times and some of the worst times in my life. And this is true for most people in this country. And that's also why I care so much about better technology in health and care. Because technology is how we make sure that over the long term, the NHS can always be there for you and your family. And I want to go into three specific reasons that are drawn out in this report as to why this is true. Firstly, using technology well frees up time for clinicians to do more of the work that they love. Talk to any frontline clinician and you will get from them a sense of the frustration that they have, that they don't have enough time to care for people, and that the technology that they use takes time away rather than giving them time back. And we need to change that. Talk to anybody working on the front line in the NHS, and they don't generally want to talk about robotics or genomics. They want to talk about time. For the front line, it's the most precious commodity that there is. Clinicians, for instance, want to know, why do they have to remember 30 different usernames and passwords just to do their job? Why do they have to spend so much time manually copying patient records from one system to another? When a confused patient turns up on a ward, why can't they quickly pull up their records and see what medication they're on? Build the technology the right way and we give clinicians back the precious gift of time. The second thing is that we need to bridge the gap between finite resources and growing demand. As you said, the NHS is funded by taxpayers' money, and I'm acutely aware that the money that we put into the NHS is all paid by taxpayers. But there's growing demand for health services, and we need to make sure we do everything we can to meet that demand. So through faster, more accurate diagnosis, for instance, by using technology, we can help to bridge that gap. Come with me to Hammersmith Hospital, where a team of researchers based at Imperial are trialling new artificial intelligence that can predict the prognosis of ovarian cancer, and the software is up to 4 times more accurate than current methods. In Surrey, people are staying in their homes longer because NHS organisations have been using wearable technology and internet-linked devices to support patients with dementia and their carers. It means that carers, and often carers are not paid for carers, but spouses and loved ones, carers can pop out for a pint of milk, knowing that an NHS team is monitoring the patient in real time. These sorts of small changes improve lives immeasurably and make services easier to deliver and help to bridge the gap between finite resources and growing demand. We can also use technology for better prevention. Ultimately, keeping people out of hospital in the first place is the best way to reduce demands on the NHS. Now, the research shows that only about 20% of the impact on your length of healthy life is determined by what happens in a hospital. The other determinants, the environment in which you live, the choices that you make, and your genetics, have around 80% of the impact. Yet we spend the vast majority of the money that we have for the NHS on what happens in hospital and on curing people after they've become ill. We can change this by helping to support people to stay healthy in the first place, and this prevention agenda can be enormously boosted by the better use of technology. That way, not only do we give clinicians more time, but we give patients a better life, helping people to stay healthier because prevention is better than cure. And here there are exciting developments using the ability to predict better who needs support in advance, rather than simply to solve the problems once people are in hospital. The third thing that's important is making sure that we get the underpinning right. Ultimately, we need to build a modern technical infrastructure for the NHS. We need to make sure we get the rules around data right and the data layer, so your medical records can be accessed wherever you are in the system, just as you can access your emails on a whole number of devices. We need to mandate standards to ensure systems can talk to each other, and these interoperability standards need to apply right across the NHS. And we need to attract the best digital minds to come and work in the NHS, which is why we're setting up NHS X, an organisation specifically designed within the NHS to promote the better use of technology, data, and digital. And we've got to build a flourishing health tech ecosystem to supply us with the world's best health tech. So we, instead of having a small number of very large suppliers providing all of the technology into the NHS, we can have innovative new companies coming to the fore and providing so that we can improve services for patients. And of course, the technology ultimately is the easy bit. The hard part is turning a promising prototype into a system-wide improvement that the 1.4 million people who work within the NHS will pick up and use. So we want to bring a bit of the culture of the internet to the way that we deliver technology in health and care. Agile and iterative and open, always looking for new ways to improve the services that we care about for people. So ultimately, this isn't about the apps or the interoperability or the APIs. It's about making sure that we spend the money, the taxpayers' money, that goes towards the NHS as well as we possibly can. And the reason we care about that is because it's about giving you or someone you care about the very best chance of a long and healthy life. That's what we're in it for, and it's an exciting journey, and we're only just getting started. And I'm grateful for all the contributions to this debate that can show just what we can achieve. Thank you very much indeed.